안녕하세요. Dr. May Hang. I'm a family nurse practitioner. And today I just want to share a little bit about my journey, how I got here. So I was born in Laos. I came when I was 5. When I was little, I became a nurse because when my family first came to the United States, we've been here for about 50 years. So when we first came, I, as a 10-year-old, was the one with the best English skill. So when my grandmother became ill in Homona, she went to stay at the hospital for a couple of weeks. I was the only person who can stay with her every day because I knew Hmong and I knew English. So the hospital staff had to resort to the 10-year-old to interpret all of their concerns and what they were trying to tell my parents about what was wrong with my grandmother. She ended up passing away with stomach cancer, but that was my first foray into healthcare and delivering care and really seeing on a day-to-day basis the people who work at a hospital, what they did, the difference between the nurses, the doctors. And so that's what got me thinking about what did I want to become? But I think some of those barriers that I experienced along the way were in my generation as a Hmong woman, it was really hard to be that one Hmong girl in high school that wasn't married yet. So I struggle a lot with just reconciling social pressure and cultural pressure because when all my friends were getting married between 16 and 18, I was the one girl who walked across the stage receiving my diploma, not married. My generation, we weren't as fortunate, but as an individual who felt that, for us to make a difference, to change our life, to achieve that American dream, I was okay with not being accepted culturally or socially. As a nurse practitioner, what I do every day is I evaluate patients for their illness, their physical symptoms that they may be experiencing. I also do well visits, men, women, children, and I practice at a federally qualified health center. So we see a lot of patients who might have language barrier, difficulty navigating the system. We see patients who have insurance. We see patients who don't have insurance. So I am always learning. And in growing up, I did not see a lot of Hmong nurses, obviously because our community was so new to the country. And a lot of the people I saw that helped me along the way were nurses who were not from my community. So I started thinking about how did that come about? Where was that shift? And I did come across a oral history research published article that was done with a group of nurses in California. And again, those researchers, they were our Caucasian counterpart. And the one person who was from the Hmong community, she was a social worker, Dr. Mai Yingli, and they did an oral history research where they actually talked to the Hmong women who during the war were recruited and trained and to be medics and to be nurses. And I never knew that I had all these trailblazers and all these people who were my role models that did this in Laos. And I was so amazed by it. I decided as the president of the Hmong Nurse Association, we were going to look into this legacy. We were going to look into how we can continue to celebrate their contribution to nursing, to the Hmong history, to the whole diaspora. So we did find out that there were originally 40 young women who were part of the first core group that were trained by the USAID. During the war happening at the Samtang Hospital. Our exhibition that we will be showing at the 3rd National Conference, which is happening August 7th and 8th here in the Twin Cities. The conference will be happening at St. Catherine University. We will have continuing education for nurses as well. And I won't give away everything. So I'm just gonna close it there. But I do and will encourage everyone to attend. Specifically, it says Hmong Nurse Association Conference, but you can attend if you are not a nurse. If you are a social worker, if you work in healthcare, if you are a physician, a medical student, a nursing student, we would love for you to attend because we feel like we have put together a robust curriculum rooted in culture, identity, and how that is going to help a person achieve a good health status. So we look forward to seeing all of you. And again, please check our website to get more information about our schedule, our agenda, to register. And thank you again.